Good morning, everyone. My name is Dr. Dick Walker. I think you know me from past webinars. It is October the 16th or 17th, I believe. This morning, I'll be doing an interview with Dr. Jay Lepp, a chiropractor, and I'm going to let him introduce himself. He's from up in Canada. We become friends through this business, and we're just going to talk about his involvement with ASEA, and hopefully those of you who are listening who are healthcare professionals will get a better understanding of how Dr. Lepp has integrated this into his practice and into his life. So Jay, why don't you just introduce yourself, where you're from, just a few of those kind of things, and then I'm going to ask you a few questions this morning.
Sure. So yes, I like people to call me Dr. J or Jay. Only when I say this that I realize I'm an old timer. It's like I've been in practice 32 years. I'm a chiropractor. But in the last 24 years, I've been doing something called network spinal analysis. It's now called network spinal. And what that is it's a type of chiropractic that cues the nervous system to build this neurospinal respiratory wave. And that creates a passion for me because it's all about the nervous system's communication, helps people with the organization of energy efficiency, and they become able to kind of dismantle emotional conflicts in their bodies and assess and assimilate information in their bodies more effectively. So that kind of sets up why this ASEA has become so powerful in my life. So it'll help in the story as we go on. So that's kind of what I do in my life as a practicing chiropractor.
And where are you from? Where's your practice, Jay?
I am in a place called Port Moody, so it's just outside of Vancouver on the coast.
Okay.
So British Columbia is the west side, and Port Moody is a small community, growing, but it's a smaller community outside of Vancouver.
Yeah, that's a beautiful area. So you've got an active practice. You've got a kind of a subspecialty of chiropractic. How did you first hear about, or how did Redox enter your lexicon of things that you might be interested in and might be able to apply?
Oh, that's a great question. I think, yeah, this sets up it's kind of an interesting story of how I became first aware of ASEA. So it starts with the premise that I'm already really fascinated with communication within the body. And then a sequence of events happen. It's almost like that movie with Kevin Costner, Field of Dreams, where you build it and they will come. So that sort of happened to me. So if I go back in time a little bit, I like to use the word grok when something really clicks with me. And when I heard about the vagus nerve becoming 90% sensory, so the information of the vagus nerve was not always very well understood. And then research starts to unfold that it has all this power. And I had heard years ago that it was 90% sensory. And then another flash of insight came from Heart Math Institute when they started talking about the brain within the heart. So there's these 40,000 cardiac neural cells that communicate with the autonomic nervous system to help smooth out the heartbeat. And then 2 summers ago, I was driving on the highway, and this interview, literally, I had to pull over. This was a woman. Her name was Kathy McCoy. She's a researcher at the University of Calgary. But her research was just so mind-blowing to me. Like I said, I had to pull over. So what she was talking about is signaling molecules. So that word came up before Redox for me. But in this case, it was the mother's microbiome and these signaling molecules from the bacteria that help educate the fetus about the developing immune system and what it can expect when it becomes a baby. So we have these signaling molecules from the microbiome, along with maternal antibodies developing an immune system. So like I said, that shook my world. And then enter now more recently, so it was, I guess it's just over a year or so, a woman came into my office and she changed my life. So here's this background of me. And then on one of her visits, and her name is Pippa. Hello, Pippa. Hopefully she's watching.
I bet she is, yeah.
She changed my life. On one of her visits, she said, Jay, have you heard of redox signaling molecules? And there's that word signaling again. And I said to her, I said, well, I know about antioxidants and I know about redox equations, but I had never heard of the term redox signaling molecules. She said that to me, and I said, first of all, I go, how the heck does this woman know these? I've never even heard of this, and she knows this. So that first, again, this has to be an important moment. So that's what cued me to be listening now to what she said. But at the same time, I was thinking, oh my God, she might have something now. I'm happy with my practice. I don't really want to add things, and I'm loving the way it is. But here she is. She's brought this information to me. I know it's important. If it has the word signaling in it, it's important to me. So she was in care for a little while, and I think it was probably a month later. Now, in that time, I essentially told her, look, I don't really want to do anything. Maybe you could just sell whatever this product is in my office. But anyway, it was about a month later, she came in, and her hair was lustrous and her skin was glowing. Now, my results are pretty good, but in a month, I don't see I don't see hair changes and I don't see skin become glowing. So I knew right away this is the redox signaling molecules. So she had my attention, and that's kind of my awareness of it. So thanks to Pippa, I was kind of mind boggled, but it was her. She validated its results for me because of what she looked like after using it for, I don't know how long before that, but it was within this month period I noticed changes in her.
That's amazing. Pippa just said hello in the chat.
Hello, Pippa.
And she's glad that we're on together this morning. So, that is so typical that a lot of us medical professionals find out about redox signaling molecules from our clients or someone in our family or someone that we just know of has an amazing, breakthrough in their health. And then we start to ask, well, what happened there? Because it doesn't sound like Western medicine would have done that. And then we start down that trail and we find out some wonderful things. So you heard about redox signaling molecules from Pippa. And that fit in with your kind of previous interest in signaling within the human body that you've been, kind of studying for a number of years. How did it go from hearing about it from Pippa to, and not necessarily wanting to add another business, but how did it go from that to eventually sharing it with patients and now, sitting in on this interview talking about kind of integrating this into your world? So how'd that happen? What happened there?
That's a good question, because I often think about that too. I go, how did this unfold itself? Because it just started to literally unfold itself. But so first of all, her results completely validated it for me. I think seeing is always believing when we see stuff. So that rocked my world, because I hadn't seen that even with my own care, and it's just something that dramatic so quickly. And then there's that craving of wanting to learn more. So I realized I didn't really know that much, and I wanted to learn more. I did love the fact that it's its own category. It's its own thing. It's not the same as a mineral or a vitamin. It's literally its own category. So that really intrigued me. And I do love the challenge. My work is kind of hard to explain. And people often say that. They go, Jay, I don't know how to explain it. And I just tell them, discuss what happens to you when you have your visits. You don't have to explain what it is. Just literally tell them what your experiences are. And that's the fun with ASEA as well. You don't have to be an expert to start explaining what happened to you with it. We have experts, and that's what I started to realize myself. I go, I don't need to learn everything yet. And I'm going to learn more and more as I go. So then I started to listen to, of course, Dr. Walker. He's been a mentor now, and I love his science presentations, and I like how clean he is in explaining it. There's some beautiful people that I've listened to now, Jerry Wright, William Friedman. We do a regular talk with him, and he helps the starting associates. He's wonderful. Pippa is always there for information for me and help. Gina Moran, these are the people that I've listened to. There's more, but these are the people that I've really been educated by. And then I do my own. I love to look up on Google Scholar and look at articles about redox, and it's exploding. So that was my next step. And I just realized there was a point in time where I can't keep this for myself now. It's too important and I have to start sharing it. It almost didn't feel right to just keep it for myself.
So I know that, you're a busy guy. You don't have a lot of extra time to be sitting around educating patients about redox and how it might help them. So how did you sort of leverage Pippa, who was your sponsor in ASEA? How does she help you integrate that? I know you do some monthly things, and I think healthcare professionals be interested in, when they're already strapped for time, and they look at their busy schedule, and even if they become super impressed with what this can do, I know that, they're scratching their head and thinking, how can I do one more thing? How can I, especially when they haven't done this sort of thing in their practice? How do they do that? How did you do that?
That is a challenge. And I can tell that when I've talked to some other chiropractors, that's kind of the stumbling block for them too. They don't know how they're going to add something else. So the blessing for me, and I think that would be for any practitioner, is if they can find some people, and that's part of this process. You don't have to introduce everybody as an associate. I have it really easy when it comes to a preferred customer. I'll just suggest people take it for a 90-day challenge. But now if it's an associate, then we have a great system because we do have a superb team. And I love the idea of the concept of this type of a selling or exploratory business, the model of network marketing, where we use people to develop and then become associates to help us grow, and we help others grow as well. So it's a wonderful wellness concept. So I had been involved in things like that before, but never been with a team that's so congruent with that idea. And Pippa has really been kind of the moving inspiration for me. She's so helpful. So what we do simply is sometimes I'll just introduce it to people and I can give her contact name, and she'll guide people through the process if they're interested in being an associate. And she also guides the people that are just wanting it for themselves as a preferred customer. So I might get them sparked that she'll help them and educate them on the process if they want to introduce it to others, or if they just want it for themselves. And then I have a whole host of things we've kind of brainstormed, and now we have a monthly meeting for people, which is now like an in-person service, which people are loving again because it's been kind of a cold, cruel world where we've been on just online, but having non-virtual, now it's live where people can be together. So we do once a month a meeting in our office where we discuss. Dr. Walker comes on. We're going to also have William come on periodically, where we talk about results and some of the background of the science so that people get familiarized with something that they obviously do not know because it's such a new category. So that makes it fairly streamlined.
Yeah, those monthly meetings I think are working out well for you. And
fun.
It looks like, how did you get engagement with your staff? I don't think you have a very big staff, but I know that your staff support you, and some of them are at those meetings. Some of them are involved with you, I think, in the business. And how did you do that? Did you explain what the process was there?
Well, now we have it so that we have a team of wonderful people. There's a woman named Kelly. Maybe she's on. Hi, Kelly. They're now becoming a great support system. So we're out there inviting maybe a person or two to come to the meetings. We have a little sign-up sheet. It's really simple. There's a little poster I make, and people sign up, and we try to get the other associates to bring somebody, and then it becomes a fun meeting where we chat and we hear stories, and that's then simple education for people. So they learn about actual stories or the stories from other associates of what made them excited about it or what their changes were. And so people hear it, they share their own, they start to understand a little bit about how this whole process works. You don't have to sell, you just explore and talk. When a person has a wound or a challenge in their lives, you can introduce some of the things that you've done, and it can go from there. It's very simple. It's not that you have to push, or it's create the intrigue through just discussion and asking questions. And I always tell people, just tell them to come out to this little meeting. It's very simple. They could be introduced to some massively interrupting category information that they've never heard before that will have an impact on their life.
I would imagine that your staff, if they were, a little bit skeptical at first. I would imagine that the experiences that your patients are having that they've known over the years too, they're coming back and reporting results. I imagine that probably has an impact on the others in the office as well, or it seems to anyway.
Yeah, well, it's interesting because some of the staff, like I'm just thinking of one staff member that's been a little stubborn, but she can't help but see the changes, and she sees, like, I have some retail selling too, where people have no interest in this at all, but they'll buy the product retail, and we do move product like that, and she sees that happening. So she's now become more supportive because she sees changes in people and their own excitement, and it makes it more friendly in the office as well. So when people are healthier, they're friendlier, and makes the office more fun. So now she's educating others in a better way, because at first she was a bit resistant to have to talk about it, and now it just comes up naturally because there's enough people in the office using it to talk about it as well.
Right, and you touched upon it, but how important in letting new people know about what this is, what it can do, that sort of thing. I mean, both of us are really interested in the science of redox, and that's one of the reasons why I started this series. But if you were to say, we've got science here and we've got stories here, we've got real experiences, what's the best way to introduce new people? Is it through the science or is it through the stories?
So I gotta throw that one back at you. What do you feel? That's a great question. I love that question because I think it's the skill of being a practitioner, because I am so excited about the science, but I know not everybody is, so that we have to kind of understand where that person comes from and what's interesting to them, but also what is their pain or what is their issue that they're having, because that can spark. Whenever you can help understand what that person is needing in their lives, then you can start asking questions, and the questions can turn into then a suggestion. I love to me now the best thing is the 90-day challenge, where now there's no obligation. It's simply a trial period, and they can decide and then do the challenge. You will see changes. Will it change every condition you have right now? Maybe not, but you're going to see some improvement in things that you may be surprised by. And with that, I'm going to just say I have an incredible story. The skin things, like I say, I haven't seen one person not have skin changes, but I have a story. My father, he's 84, and I just suggested it to him, and that's back about 6 months now. So first of all, he phoned me one day and said, "Jay, I don't know what's going on here, but I keep having more and more products show up, and I don't know what to do with it." I said, "Dad, are you taking the 4 ounces?" And he said, "Oh no, I'm just doing 2 ounces a day." So he'd have extra product because he wasn't using it. He hadn't remembered what I was telling, and I just told him to do this maintenance dose. And it was interesting because I had visited him on the Labor Day weekend. He hadn't told me this, but he suffered from benign prostatic hypertrophy for a decade. He can't sleep more than 3 hours without having to go pee. So every night is disrupted. So after 2 months, this is when I was visiting on this Labor Day weekend, he said to me, "Jay, I don't know what's going on, but my prostate is now normalized, and my PSA levels are within normal ranges now," which is unheard of for somebody my age that's had prostatic hypertrophy. So his life is completely altered. He sleeps now 5 or 6 hours, and he's changed the condition at 84, but he was only taking 2 ounces. And he's documented it. The PSA levels were documented from his medical doctor. That was just, to me, mind blowing that happened for him.
Yeah, that is. I'll just slip in the disclaimer here because we started talking about a medical condition. ASEA doesn't cure, heal, or treat anything. What it does is it gives our body a very intriguing tool that it can use to fix and repair things, even things that have developed over a prolonged period of time. And so, those kinds of stories are the ones that impress me the most. And that's not an uncommon kind of a thing. And we know when something like that happens to family, it really, really drives home the effectiveness of this, because you know what they've been living with for years, and you know all the different things that they've tried unsuccessfully in the past to try to correct that. And and not even expecting that it was going to do anything. I'm sure your dad didn't expect that it was going to.
Yeah, and he hadn't even told me that. And I that's how I explain it to people too. This is an organizing phenomenon in the body. So we're not diagnosing and treating a condition. I'm suggesting to people that take it so that your inborn intelligence now can activate at a higher level, because we're replenishing a system within the body that will do things that you can't do as well when you have less of these.
Yeah, Lee Osler in this book, and if you haven't got it, everybody that's listening, be sure and get this book that Lee Osler wrote called Redox Matters. He points out the concept of the inner doctor, that whole system that has evolved over time at our cellular level, that's a fix and repair strategy, and how redox is so vitally important to activating and supporting that inner doctor within us. So I'm going to switch gears here and say, how do you, if you're approaching another healthcare professional, what advice could you give for how to really validate this for yourself, where to go for information, what to look for, in addition to the stories? Because I know that a lot of healthcare professionals, although the stories are nice, they want information. What did you find was the best source for you, other than talking with me and other healthcare professionals? What's your go-to source for redox information?
The best, well, I did my own, I Google Scholar, and then PubMed, looking up studies and seeing how, first of all, you just start to realize it's fundamental within almost all systems. What is it fundamental? It's a cellular response in the body. And I love the fact that this, at first they didn't know what it was. It's like an offshoot of the Krebs cycle. And here's these molecules that they didn't know what they were doing. And yet, of course, in the body, there is no coincidence. There's always this incredible redundancy of operations. So they weren't wasted molecules. They were doing something quite magical. They just didn't know yet. And so then when you start reading about what they're looking at, it just reshapes you, because you see they're involved in everything. It is this master communicating system. So yeah, that's my own research then just led to craving more. And that's why I try to get on anytime you're speaking, because I want to get more of the science, because I find it just fascinating. And it helps me kind of get more strengthened in it's just kind of like an inspiration of just how incredible this body is. And yeah, I'll tell other practitioners the same thing. Something created passion with them with whatever they're doing. So I said, I'll tell them all the time, what would happen if your results are even better now, when you can activate a process in the body that could be replenished and working even better? Because something created passion within any practitioner to do what they're doing, whatever their tools are. Now you could even upgrade it. And I always think, geez, there's a fellow, Peter Diamandis, he always talks about category disruptors. Definitely I see it as a category disruptor. So I see the point where this is, when it becomes more known, I would sense that this will be a disruptor of other things that become less relevant, because this just has such a powerful effect.
Yeah, that said, where do you think this will be 10 years from now? What do you see if you were to kind of sit down and just say, I wonder where redox is going to be, 5 and 10 years from now? What kind of thoughts enter your head when you think about that? If you ever do, I'm sure you do.
Oh, I do a lot. Trust me. That's a huge one that I think about, and it really is a driver for me. So that would raise the point of the elephant in the room. We'd have to, because I see it as, we see this, the sensitive topic of where we're at in the world right now, where we're really driving home a kind of a message that's not as powerful as what I believe this one is where we talked about this inborn innate intelligence. And then we're watching in our world where we're, and I'm not criticizing, but we seem to be worshiping another way of looking at health through big pharma. So that's not the same, because then we're thinking that health can only come from the outside, and it's something that we have to be like, it's a pill, a potion, or lotion that we have to do. Instead of, now we can prime this innate intelligence and replenish it with what this innate God-given healing doctor, the doctor within. So that's like it's the thing that people can't talk about. It's a different perspective about health. Wow. So if we shifted that perspective, I think we would say that is just, that's groundbreaking. I think we'd see incredible changes in humanity.
Yeah, I know personally, I think that, when the powers that be are talking about how do we solve the healthcare crisis, we're spending, an ungodly amount of our budget on pharmaceuticals and on Western healthcare. How do we solve that problem? And, they're always looking at administrative fixes or whatever. And, in the back of my mind, we've got a large part of the fix right here. We have to do whatever we can to nurture, support, activate that inner doctor, those mechanisms that have kept our ancestors alive for years, before there ever was medicine or doctors or any of that stuff. The human race would have never gotten to where they are if we didn't have some pretty powerful inborn, innate, whatever you want to call it, mechanisms for keeping us alive and fixing problems. So I agree with you. I think we are just barely scratching the surface. And I think looking at where this company is going, I think we're going to see more and more and better and just other applications. And I don't know about you, but that gets me really, really excited.
Yeah. So if you want a bigger vision of why you would want to introduce this to people, that is definitely a huge passion driver for me. The fact that we could help people move from a kind of a sick care conceptual framework to a wellness model. And that in itself, people start thinking from that perspective, gaining and improving health rather than battling what's wrong with them. Wow, that can excite you getting up every morning.
Yeah. Build that fortress of health around you so that those nasty diseases can't get a foothold. That's how I see life, and I see that increasingly as I get older, how important that is. We can wrap this up with one or two more practical things. How important is it when you're starting somebody on the ASEA molecules to establish a baseline where their health is like right now, and give them a tool that they can use and you can discuss with them about improvements? Because some people don't notice that their hair is a little bit better, or that their skin is a little bit better, because that happens over a slow period of time. But talk a little bit about how important that results tracker is and baselining is for new people.
Yeah, it's so important, and yet it's still really tough to get people to do it, just because it's, again, behavior changes are so hard. I always that's where, if a little bit more time with people, if they can come to one of these evenings and things, then there can be some shape shifting, because a lot of times people's behaviors just kind of drive processes where they're on autopilot, so they cannot even introduce a new habit. But if they can just do that, and that's what we try to keep it really simple, look at a framework of 90 days, ask and watch yourself and see what questions come up and the different questions. I always find I see a person changing their health when their questions get better. So rather than always just, what's wrong with me? Why does it keep hurting? Why do they keep asking that same question? Ask questions that are a little bit more intriguing than just, why does this keep happening to me? Or why does it still hurt here? That one kind of sends you on a bad loop. So the tracker is really good because it's giving you a spectrum of looking at a little bit more elements. So it's already moving you out of your symptom picture into looking at things from a wider perspective, looking at the whole body, the systems, the integration. If you can do that, again, you start to then go, wow, okay, so I didn't even notice that this, like, my sleep was better, or now I habitually seem to drink more water. Like, those are really interesting things that start happening to you. You move into behaviors that are a little healthier as soon as you upgraded some of the communication within your body. again, that little doctor inside starts giving you little hints that there's new things you can do, and you can get off your tracks that have kind of repeated the same behavior.
Yeah, that's a really interesting observation. So, do you have another story to tell? Do you have another favorite response that you've seen in some of your clients or family or friends that have integrated this into their health?
Well, I kind of want to, I would love to just be able to suggest something. I could give another story, but this is to me kind of a very, really interesting way of looking at yourself too. And it comes from, we're all creating ourselves, and we're creating an identity through that. It's literally having to be coherent with ourselves. And then there's these infinite possibilities that we could choose from. And yet we somehow create choices by noticing things, and then that creates a response. So if you realize that a lot of that is going on at a kind of an autopilot level, but you could move to a greater awareness, you are going to change yourself immensely. We're maybe aware of maybe 5 or 6 things happening in the body in any given moment. Now, what if that whole system upgraded itself so we become more aware? So from the cells inside out, if we become more aware, and if you can have a cell become more informationally efficient, we're going to see changes in our own awareness, and then how the choices that create us unfold. So to me, anything that we can do, and that again comes back to just understanding that there's this innate intelligence. It's our designer, it's the architect, it's the who we are. If we can upgrade that, and we may not know why aging has given us less of these molecules as we age, but if we can replenish, these possibilities then become immense.
And who knows if they have to decrease over time? Maybe that's a function of our 20th century lifestyle. Who knows?
Yeah, exactly. We don't know that that's maybe, yeah, that's, but right now we have an amazing tool that can replenish us, because what is it? What is the stat at 50? We have what, 50% less of the replenishing molecules?
Yep.
So if we can upgrade that now, maybe we'll see changes in how our bodies self-organize.
Yeah, I think I agree with you. We are just scratching the surface of what can happen when we utilize these molecules in an intelligent way to empower that self-restoring. I like Lee's term, that, and maybe he didn't coin that term. Maybe he just found it as he was doing his research with that inner doctor. And I think I have, one of the things that's happened to me, and I suspect this happened to you too, is that I have a much better appreciation for what the body can do if we simply give it the right tools. You know, so many of us MDs anyway, I think we fall into a pattern of thinking that that the body is flawed in its ability to deal with disease, and that's why people end up coming into our office, because they have all these problems, and so we underestimate the power of the human body to fix and repair itself. And we don't look for natural things that we can do to empower that, and yet ultimately that is the best solution. And ASEA has just really restored and magnified my understanding of the power of that inner doctor.
Yeah, I totally agree with that. And as you do your own research, you start to see the immensity of how complex the body is, and you realize you'll never know enough to be able to talk about what this redox signal, because it's infinite. You'll get better, but let's face it, we barely have scratched the surface on understanding it ourselves in the research world. All they do, every time I read something, it's just like it asks more questions about, wow, what is this? So it gets more and more deeply complex, and yet there's a simplicity to it in what it does to help our bodies express health.
And ultimately, you don't have to understand any of this. All you have to do is take that blue bottle that's sitting on the shelf behind me and pour a couple of ounces in a glass several times a day and drink it. And the magic happens, right?
And the magic happens, and it's wonderful to be able to tell people too that you already have these molecules in you, and there's zero toxicity. You cannot hurt yourself with them. They're safer than water.
Yeah, it's you know, as I've said before, it is the safest least toxic product that I ever mentioned. So on that scale, it's superlative. And then it's also, quite frankly, probably the most beneficial thing that I've recommended to people over the years by far for people to improve their health in so many different areas. Yeah.
Yeah, it's sure fun to hear people tell you what's changing. So that's that. Again, if they do get inspired by that tracker, it's really fun because then they'll start to see the spectrum of changes that they weren't expecting. I mean, it's always something else that changes along with, like for me, there's one last little story. I played football in university in my 20s right up to now. My knees have always been creaky. I had an ACL ligament injury, but it wasn't fully blown out, but both knees were always creaky. So I don't have a lot of pain, but they would always be noisy and squeaky. So I wasn't expecting that change. And it was about 4 months in, I realized there's no noise in my knees now. I just find that fascinating. Again, so now I've organized connective tissue, which is one of the hardest things to change in the body, is scar tissue and fibrosis within a ligament or muscle. And here I am now watching that happen to myself. So yeah, that's really exciting. And that's way further in. It's not like something that was immediate. It was way further in my regular use of it.
Yeah, that's amazing. We'll have to add another category to Alan Noble's Redox results, creaky knees, right?
Creaky knees, yeah.
You know,
Crepitus and crunchy sounds.
Even though they didn't hurt, it wasn't normal for those things to be squeaking, right?
No, and you see, we get to see now an upgrade because now they're like a child's knee where you don't hear creaky knees on a child.
Right.
So they're smooth and a lot more silky, and yeah, that's fun, and you can feel that's like there's a lightness within them, so the hinge just feels better again. So then that's another level of awareness. You realize, wow, there's a level of movement that you don't realize can be a part of your body.
Yep.
Now I'm not saying that may happen for everybody because some people might have nastier knees, and when mine had been injured, but there was still lots of room there can be a point in time, I suppose, when you're really crossing that threshold of what's available, but you'll still have improvement. I have a woman, she's in her 80s and she has chronic obstructive pulmonary disease, and you're not supposed to be able to do much of anything when you have that, and it's quite far advanced. She can go and get checked by a respiratory physiologist and they'll see blood oxygen levels that are normal, which is, again, they don't even know what's going. It's sometimes so much for these people, they don't even ask a question because it's like they can't. So that respiratory physiologist doesn't ask what's going on because it's just almost not comprehensible by him or her.
Right. Yeah. To see somebody improve like that, since they don't have a tool that they can accomplish that with, when they see it, they just can't believe it, and they just
can't believe it.
Yeah, they just
leave it as a default of miracle, and even though that should be in and of itself amazing, but right. When they can't process it, they just leave it alone. Yeah.
Well, thank you very much for being available. I've enjoyed our chat this morning. I think people have probably gotten quite a bit from it.
I hope so.
Yeah, well, it's I think it's always a great thing for people to hear from another professional about their attitudes about this, how they've come about, how they've developed that understanding. It's not an overnight thing, and it's this new technology. It's a whole new world of understanding and how we can help people to improve their health. And you pointed out one great point that I think a lot of people don't understand. We live for years with things like that creaky knees or that shoulder that just won't do what it's supposed to do or whatever. And we've come to accept it as just, we've just got to put up with it because there's nothing we can do about it. And yet time after time after time, when people start supplementing with Redox, a lot of those little annoying things that you've been putting up with, which usually represent something wrong with the body, they just sort of disappear over time. And that's because you've activated the inner doctor, and the inner doctor knows what to do over a period of time to get that taken care of. So, Jay, thanks again.
Thanks for the privilege.
Well, thank you. And we'll have this available so that if people want to send it off to their favorite chiropractor to take a look at or whatever, it's available. So thanks again and have a great weekend.